Yes, sir. 3, 2, 1.
Good morning, all of you. Yeah. Again, welcome and most welcome to Urology teaching program. Today topic is method and physics of ESW and various intracorporeal lithotripters, and presented by Dr. Naveen Kumar. Please share.
Very good morning, my respected teachers, my seniors, and my colleagues. I am here to present my topic on seminar, Methods and Physics of ESWL and Various Intracorporeal Lithotripters. Myself, Dr. Naveen Kumar, and my moderator is Dr. Manoj Kumar Mamania, sir, Assistant Professor from the Department of Urology, SMS, Jaipur. Thank you, sir. Various type of lithotripters are available right now. They are divided in intracorporeal type of lithotripter and extracorporeal type of lithotripter. Extracorporeal type of lithotripter works from outside of the body, while intracorporeal type of lithotripter works inside of the body. Intracorporeal type divided into two groups. They are divided in flexible type of lithotripter and rigid type. Flexible, we have laser and electro hydraulic type of lithotripter, while rigid in we have ballistic type and ultrasonic type of lithotripter. While extracorporeal type lithotripter use few types of generator like electro hydraulic generator, electromagnetic generator, and piezoelectric generator. Now come to on the history of the shock wave. We heard many times about the Dornier. Dornier actually was the German aircraft manufacturer. In 1980, they used first lithotripter on human subject known as a human HM1, human model 1. In 1984, ESWL approved by the FDA for the treatment of stone disease. And first commercially available lithotripter was HM3. Now come to on the introduction. As I earlier told, extracorporeal type of lithotripter works from outside of the body and they produce shock wave. These waves are weak wave, non-intrusive wave, and they propagate in a non-linear fashion. And when they encountered through the body, they focus onto a stone and they generate a sufficient power to break the stone. So now come to an advantage of the shock wave. Shock wave are non-invasive wave. They are safe and they reduce the hospital IPD and patient hospital time, because they can go for a daycare procedure, and these waves can be used for all age group, and they also decrease need of anesthesia. Now come to on disadvantage. Because of the repetition of the procedure may require in short shock wave, and they are not suitable for hard stone like brucite stone, cystine stone, calcium oxalate monohydrate stone, and the stone with HU value more than 1000. They are not suitable treatment, and they have many complications like early renal complication like hematoma formation, hematuria, and chronic renal complication also. So for a successful prerequisite of ESWL treatment, we need a functioning kidney and a unobstructed distal passes. If there is any abnormal anatomy like horseshoe kidney and calyceal diverticulum, they lead to poor stone-free rate. And the composition of the stone like hard stone, cystine stone, brucite stone, calcium oxalate monohydrate stone, and metric stone, and the HU value of stone more than 1000 lead to a poor outcome with the ESWL. And the distance of the stone to skin, if there is more than 10 centimeter, they lead to poor stone-free rate. And also a LVA, if there is present LVA like long lower pole calyx, more than 3 centimeter, and there is, if there is narrow infundibulum width less than 5 mm, and narrow infundibulopelvic angle less than 70 degree, it will lead to a very poor stone free rate. Now come to an technical aspect of lithotripsy. All lithotripsy machine need 4 basic components: shock wave generator, focusing system, coupling mechanism, and image or localization unit. Now come to on shock wave generator. They are divided in 3 groups: electro-hydraulic type of generator, electromagnetic, and piezoelectric generator. Electro-hydraulic type of generator, also known as spark gap generator, and they are first generation lithotripter. And electro-hydraulic generator, the high voltage current is applied on 2 opposing electrodes, and they produce spark in water, and after the production of spark, they produce vapor bubble of the water. These vapor bubble of the water collapse and produce shock wave at F1 point. At F1 point, they produce spherical type of shock wave. After production of spherical type of shock wave, these waves are reflected from the ellipsoidal reflector, and they are focused on F2 point, also known as a target point, or also known as a stone, and they efficiently break the stone. So come to an advantage of the electro-hydraulic type of generator. They are very effective in breaking the stone, but they have very few disadvantages, like very short electrode life. They have only 200 to 300 short electrode life, and need to repeated change the electrode. If there is 1 mm displacement at F1 point, it will lead to more than 1 centimeter shift at F2 point. So this is a major disadvantage of electro-hydraulic type of generator. Now come to on electromagnetic generator. Electromagnetic generator generate shock wave by EM coils. They mainly produce 2 types of waves: flat plane wave and cylindrical type of wave. Flat plane wave are focused by the acoustic lens, while the cylindrical type of shock wave are reflected by the parabolic reflected, and they focus on F2 point. And at the F2 point, they produce a very high peak energy and lead to stone fragmentation. So the advantage of the electromagnetic generator is they have very tear and wear, so they need less servicing in compared to electro-hydraulic type of generator. They produce less pain, and they are more controllable and more reproducible. But the disadvantage of this generator is they produce more subcapsular hematoma, because they produce very high peak energy at F2 point. Now come to on piezoelectric generator. Piezoelectric generator, thousands of piezoelectric crystals are arranged in a spherical maze. When the current is applied to these crystals, they deform and produce a shock wave, and directly they don't need any focusing system. They directly focused on F2 point and effectively break the stone. So advantage of this generator is very good focusing accuracy and the long service life, and they don't need any anesthesia. But the disadvantage of this generator is they produce very weak power, so it lead to very poor stone free rate or stone fragmentation. Now come to on comparison of all 3 type of generator. So piezoelectric generator has a very good focusing accuracy, long service life, but they are very poor stone comminution. This is the major disadvantage of this piezoelectric generator. While electro-hydraulic generator, they are very good in stone breaking, but major disadvantage of this generator is very short electrode life, and they have 2 focal point 1 and focal point 2. While in electromagnetic type of generator, they are controllable and very reproducible in compared to electro-hydraulic type of generator, because they don't use spark plug. So electromagnetic generator have long electrode life and cause less pain, but high energy is delivered at F2 point. It is a disadvantage because it leads to subcapsular hematoma formation. Maximum hematoma formation is seen with Dolly's as lithotripter. It is about 12%. So various design of lithotripter is available. In modular type of lithotripter design, all the component of this machine need to connect it before performing an ESWL procedure or an endourological procedure. In integrated type of lithotripter design, all the components are fully integrated in one standalone system. While in a hybrid type of lithotripter design, all the components are mounted in a single combined console. So in our medical college, we have Dornier compact delta 2 type of system. It is an integrated type of system, and it is based on electromagnetic type of generator. So with the newer lithotripter, they generate shock wave outside the body in a shock tube, and they also eliminate the bath of the problem, and they have decreased power and cause less pain. Because of the decreased power, the stone fragmentation also reduced. So the retreatment rate is very high with the newer lithotripter. Now come to on second point on coupling. Coupling is very important in lithotripsy, because it bad coupling lead to a dissipation of energy and lead to very poor stone fragmentation. Usual coupling medium is water. First generation lithotripter, patient was placed in water bath, while in second and third generation system, they use small water-filled drums and cushion with silicone membrane to provide the air-free contact with the patient skin. If there is only 2% of air pocket is present in coupling area, the stone fragmentation or stone communication is decreased by 20 to 40%. So we need to good coupling for a good outcome and decrease the air pocket in the coupling area. So for various jellies are available for coupling. Silicone jelly, petroleum jelly, USG jelly are need to coupling. Now come to third component, stone localization. Stone localized by the fluoroscopy method or by the ultrasound method or by the combination of the two. This picture showing the ESWL outcome before the treatment of ESWL. The stone are localized, and post after ESWL procedure, some amount of stone fragment is there. But on day 42, there is hardly any stone fragment. So it is a very good for stone free. It is it's showing a very good result in post ESW day 42. There is no stone at all. So advantage on the fluoroscopy, it can visualize the radio opaque calculi. And second advantage of this, it is very familiar to most of the urologists, but major disadvantage of this technology is it is the radiation exposure to the staff and the urologist itself. It need a very high maintenance, and it is poorly localized the radiolucent stone. Now come to on ultrasonography. The advantage of this technology is it is inexpensive and in compared to fluoroscopic system. It can be used in children and they not expose any radiation, so they are safe for the staff, for the surgeon, and for the patient also. And they can localize both types of stone, radio opaque and radiolucent stone. But the disadvantage of this technology is they need a very high training of very trained operator. So now come to one mechanism of stone fragmentation. There are 6 mechanisms of stone fragmentation, like spall fracture, squeezing, splitting, shear stress, superfocusing, cavitation, and dynamic fatigue. Now come to one spall fracture. When the shock wave are entering the stone, they are deflected because of impedance mismatch at the stone urine interface, and the wave become inverted, and they are deflected and become the negative wave and produce tensile force. When the tensile force is exceed the tensile strength of the stone, it will lead to fragmentation of the stone, and the fragment of the stone known as a spall. So this technique known as a spall fracture, and the fragmentation plane in the spall fracture technique is perpendicular to applied stress. Now come to second mechanism, squeezing splitting. When the shock wave enters the stone, they are they are very fast then compared to the wave outside of the stone. So the wave outside of the stone, at the edge of the stone, they produce a force because the wave outside of the stone are more powerful than the wave inside the stone because of the mismatch in the speed. So they produce a squeezing force on the stone and lead to stone fragmentation. Now come to one third mechanism, shear stress. The shear stress, when the wave propagates through the stone, they cause shifting of the molecule perpendicular to the wave, which result very high shear stress inside the stone. So in mathematical modeling, demonstrate that the shear stress has a more powerful force in stone combination than the spall fracture. Now come to superfocusing. When the shock wave are reflected from the distal end of the stone, they are focused either by the diffraction or by the diffraction from the corner of the stone, and they create very high stress inside the stone and they lead to stone fragmentation. Fifth mechanism, cavitation. The cavity at the end of trailing part of the shock wave, they create a bubble. These bubbles oscillate rapidly and collapse violently. When they collapse violently, they give rise to very high temperature and very high pressure. Because of this temperature and pressure, it lead to stone fragmentation. Now come to on sixth mechanism of stone fragmentation is dynamic fatigue. When the short wave is applied to stone, it damage induced by the short wave accumulate in the stone during the treatment, and after that it will lead to stone fragmentation because there is some pre-existing flaws in the stone material, because stone are not homogeneous, they are non-crystalline and crystalline part. Because of these non-homogeneous component, they have pre-existing flaws, and when this shock wave are applied to that, they will lead to stone fragmentation.
This is the same principle which is applied in the treatment of chronic prostatitis. Many times, if you look at the treatment of chronic prostatitis, prostatinemia, so patients who are having it causes microfractures in the capsule of the prostate. So this is a question which is commonly asked in DNB and also inside MCH, but then you don't have an answer for it. So it gives relief to the extension of the adenoma, relief symptoms by causing microfractures of the capsule of the prostate. So that is why it is used inside even chronic prostatitis, used inside benign prostatic hypertrophy also, and it gives some sense of release on account of that dynamic composition, that stress is released from the going end.
So by the sixth mechanism, stone is fragmented. Spall fracture because of impedance mismatch at the distal end of the stone, impedance mismatch at the stone and urine interface. Second is squeezing splitting, speed mismatch because of speed mismatch in the shear stress, shifting of the molecule perpendicular to the sound wave. Superfocusing, there is refraction or diffraction by the stone, diffraction of shock wave from the distal edge of the stone. Acoustic cavitation, because of the bubble oscillate very rapidly and collapse violently and produce very high pressure and temperature inside the stone. And the dynamic fatigue, because its own flows or its own sins, they fragmented. So most powerful mechanism is shear stress in compared to spall fracture. and third one is squeezing and spitting. So AUA recommended guideline for ESWL. ESWL is a potential first line treatment for ureteric and renal stone, which is smaller in size. For a non-lower port renal calculus, which is less than 2 centimeter in size, it can further divided in less than 1 centimeter or more than 1 centimeter. In less than 1 centimeter stone, short wave lithotripsy is the first line of treatment. If it failed, we can go for a uteroscopy. If uteroscopy also failed, we can go for a PCNL. If stone more than 1 centimeter, we look for a HU value of the stone or the skin to stone distance. If more than 10 centimeter, less than 10 centimeter, we will go for a short wave lithotripsy. If it fails, we will go uteroscopy, and if uteroscopy fails, we will go for PCNL. If there is stone, if size into more than 2 centimeter, we should directly go for a PCNL procedure, not for ESWL. If the stone HU value more than 1,000 or very hard stone like 16 brucite or calcium oxalate monophosphate stone or matrix stone, we directly go for a uteroscopy procedure, or if it fails, go for a PCNL. If there is a if there is a lower pole calculus, if there is less than 1 centimeter, HU value less than 1,000, skin surface distance, skin stone distance less than 10 centimeter, if there is favorable anatomy, there is no obstruction distal to stone, there is so we can directly go for a short wave lithotripsy. If there is HU value, if there is no obstruction distal to the stone, it is a favorable anatomy to the stone. If LPA long, there is no long lower pole calyx less than 3 centimeter, less than 5 mm in breadth, and more than 70-degree angle. It is a favorable.
Basically, you're concerned about the infundibulopelvic angle.
Yes, sir.
The more it is obtuse, the more is the favorable anatomy. The more it is
Obtuse,
the more it has to be angulated.
No.
Gravitation is
Not fast.
So that's why if you have an obtuse angle, the chances of the fragments to come out, they are more.
Yes.
And then the width is very important.
Yes.
What cutoff of width do you take now?
5 mm, sir.
5 mm. So if there is a width of less than 5 mm, the chances of the fragments coming out,
No,
they
sir.
are less.
Less.
And
Chances less.
what about the length of the infundibulum?
More less than 3 centimeter.
Length is more than 3. And
Less than 3 centimeter.
what is the difference in infundibular length and infundibular height? What is the distance in between? What is the difference in between infundibular length and infundibular height? Okay, so infundibular, if you would draw a line from the center of the calyx and it is passing through an infundibulum, the point where it joins inside the middle of the pelvis, that is the infundibular length. As you said, infundibular length 3 centimeters. In the same way, if you draw a line, a horizontal line from the edge of the lower calyx and just draw horizontally to the ground, right, that is the height of the calyx. The point at which the infundibulum opens into the pelvis, that is the height. So, jitna kam height hoga, jitna kam length hoga, that is also a favorable anatomy. But however, there is a difference between height and length. Height you have to draw a horizontal line. For length, you have to draw a line which is from the middle of the calyx inside the infundibulum, and then joining a line which is going from the upper ureter to the pelvis. And then you calculate all these parameters are calculated by these two lines. A line drawn from the upper ureter going cedar, a line which is drawn from the infundibulum going at an angle. That angle will give you the infundibulum. That length and which the intersection is going will give you the infundibular length. And then if you drop a line horizontally, that will give you the infundibular height. So these are the important parameters, and everything should be considered. So like you cannot do an ESWL in each and every case. I mean, this is important, right? Yeah.
What do you think you are sensitive. Ureteroscopic procedure. Not for kidney stone, sir. Ureteric calculus.
For two stones, I mean, he might be talking about flexible URS. So we have he's talking about flexible URS. Now, those stones you have highlighted, cysteine and brucite. So why are the success rates of lithotripsy? Why are the success rates of lithotripsy less in cystine and brucite?
Because cystine and brucite stones are very hard stone.
No, but why? Typically, why are they hard stones? That is the $1 million question. Cystine stones के अंदर क्या होता है? Brucite stones के अंदर क्या होता है? Cystine में what is the composition of cystine?
Cystine, homocystine.
Homocystine. Homocystine and cystine are the same. One was sulfur bonds होते हैं, and these sulfur bonds होते हैं disulfide bonds होते हैं,
Oh, yes.
and these disulfide bonds they are very strong. You know why disulfide bonds are strong? Because इनके orbitals होते हैं ना sulfur के वो बहुत छोटे होते हैं. So now if you have to do pairing of electrons in orbitals, then sulfur के जो orbitals होते हैं ना p orbital जहाँ से you understand the orbitals, p orbital, q orbital, r orbital आगे जाके ऐसे electrons निकलते हैं. तो the p की जो overlapping होती है ना that is very long. Short तो होते हैं लेकिन interlocking p की होती है वो बहुत strong होती है जहाँ पे कुछ है. So that is why your cystine stones are recalcitrant to ESWL. Because एक तो sulfide bond होते हैं, sulfide में भी disulfide होते हैं, disulfide में भी p orbitals की sharing होती है, p orbital में भी overlapping p orbital is much more. And brucite stone इसलिए because it has got less of hydroxyl bonds. It has got less of hydroxyl bonds. जितना water होगा किसी चीज में उतना ही it will tend to fragment. So like that is why the hydroxyl component of brucite is less. And oxalate होता है ना, so that is why मतलब it has got less of hydroxyl groups. So that is why they are recalcitrant. और phosphate में बिल्कुल नहीं होता. Even one stone that you left out, which is very hard, density is equal to that of the bone, very high ounce energy is phosphate stones. So they are calcium phosphate stones primarily, then you should not even think about going to lithotripsy. Directly you can go for real.
Now come to a newer technology, VCU tracking locking system. It has a high stone fragmentation rate. It is about 80%. It uses infrared handheld probe which triangulate the stone in a real time and use USG guided lithotripter, and they lock on the stone during the whole procedure. Now come to burst wave lithotripsy. Traditionally, shock wave used as a 5:1 positive to negative ratio, which deliver the power of very high power over a 4 microsecond. But in burst wave lithotripsy, we use positive to negative ratio 1:1 and delivered a low power about 6 megapixel over a very less time, over a 5.5 microsecond. Because of low amplitude wave, they prevent excessive cavitation bubble formation. Because of the excessive cavitation bubble, these bubbles are cover the surface of the stone and decrease the stone comminution because of the covering of the surface by the bubble, and shock wave is not entered to the bubble.
MPA क्या होता है? MPA क्या होता है? What is 6 MPA? अभी आपने बोला
6.
हाँ? क्या आपने बोला आपने क्या होता है? 6 MPA है ना?
6.
कुछ भी बोल दो कि पिक्सल जहाँ पे फिर जा रही है प्रोसेस को पिक्सल मेगा
Pascal sir.
Pascal is the unit, is the SI
Power,
unit, standard
power.
tension and pressure.
Yes, sir.
है ना? यहाँ पे भी प्रोसेस को जहाँ पे भी कंटिन्यू किया ऐसे कर पहनोगे कुकली लपेटा
Pascal.
SI unit of tension and pressure is megapascals and pascals. Pixel कहाँ से आ जाएगा?
Sorry, Pascal.
Pixel is the unit of what? Pixel is the unit of light intensity. इतना मेगापिक्सल की फोटोग्राफ इतना मेगापिक्सल there is got nothing to do with tension and pressure.
So in burst wave form, it's
So
so
we agree pressure. इसके बाद तुमने ध्यान
Pascal sir is Pascal.
Pascal is the unit of pressure and tension.
Yes. So in traditional shock wave form, it has a very high pressure. It is about 40, and in a burst wave form, it has a low pressure about 6 megapascal. In very short time. It is about 0.5 microsecond duration. Now come to a newer technology of ultrasonic propulsion. It is a handheld ultrasonic device. It can be used to relocate the stone and to the more favorable areas of the kidney, and can relocate the objective calculus and relieve the objective system.
Okay, go back to the curve. How do you explain the negative pressure curve over time? How do you explain this waveform in which the pressure has become negative? Then you are giving 40 megapascals and then see it's going down to minus 10.
Yes, sir.
How do you explain this phenomenon?
Sir, at the end of the wave or the trailing part of the wave, there is a negative pressure.
Negative pressure क्यों होता है? Because what happens is that when you're giving the wave, then first of all, the wave, when it forms a bubble inside the
Yes,
stone,
sir.
then there is expansion. The wave result in an expansion. Right? So that expansion causes a sudden increase in pressure. But ultimately it bursts and it results in a negative cavitation. So ultimately the pressure will become negative. So this alternative expansion and rupture, expansion, rupture, positive, negative, this is where the shock will break the stone. Because once the bubble will expand, expansion of pressure will increase the pressure. And then it will form a negative because it will contract. So that is why this waveform goes into negative.
So now come to micro bubble lithotripsy. Micro bubbles are containing perfluorinated carbon gas with phospholipid lipid center and have biphosphonate binding domains which attach to the stone surface. And we use a 5-inch retrograde catheter, and these micro bubble injected in the renal pelvis system. And after injection of the system, we use ultrasonic energy to fragment the stone. And these after fragmentation of the stone, these fragment of the stone are passes to the ureter or lower anatomy of the lower from the system from the lower system. So we can use shock wave in various available option are medium type shock wave can be used in heel spur, non-union of flexure, bursitis, tendinitis, while low intensity shock wave can be used in rectal dysfunction and peroneal disease. Shock wave
And prostatitis.
and prostatitis. Shock wave can be used in pancreatic stone and CVD or polystones. So now come to an intracorporeal type of lithotripter. So now come to an electro hydraulic lithotripter. It is a flexible type of lithotripter. When the high voltage current, as I earlier told, applied to the electrode, it produces the cavitation bubble, and this cavitation bubble expand and they collapse and they produce second shock wave, and this second shock wave break the stone. So the advantage of this electro hydraulic lithotripter is they are inexpensive and they are effective fragment the stone, and they are very flexible. But the major disadvantage of this system is that they have very high perforation rate and very high ureteric mucosal damage, and they need frequent change of the electrode. They need change of the probe because the probe deteriorate and setting off of the insulation.
So there you see, go back. There you see harder stones, calcium oxide, monohydrate.
Yes, sir.
So we are talking about in a dihydrate. So hydroxyl bonds जितने कम होंगे stone में उतने matter होगा.
Yes.
And hydroxyl group अगर ज़्यादा होगा those stones they are
Softer.
So that's why calcium oxide dihydrate stones, they are soft and applicable to waste
In compared to
calcium oxide.
calcium.
It's an important also if you get to know the stone composition.
In a pneumatic type of lithotripter, they use kinetic energy in form of compressed air. When this compressed air passes to the connection pipe, they cause movement of this metallic bullet this metallic bullet movement and striking on the spring connected to the pneumatic probe, and it lead to a it transmit force to this pneumatic probe, and it is striking when this pneumatic probe move, it strike to the stone and lead to fragmentation. So the advantage of this pneumatic lithotripter is they are very easy to use. There is very low risk of uritic perforation. They are good for large or hard stone, and they no produce any thermal injury. But the disadvantage of this pneumatic lithotripter, they have a very high retropulsion and they are rigid probes. Come to an ultrasound lithotripter. When the current is applied to the piezoelectric crystal, these crystals deform and produce ultrasonic wave at the rate of 25 hertz. And when this wave is transmitted through the probe, it lead to probe vibration longitudinally to the stone, and it lead to stone fragmentation. But is the disadvantage of this technique? It needed continuous irrigation because they generate heat, and so we need a continuous irrigation. Now come to a comparison of all the type of lithotripter. Extra hydraulic type, electro hydraulic type are very flexible, and but they have a very high mucosal damage or uritic perforation, while pneumatic type are rigid type of lithotripter and have a very high retropulsion, and ultrasonic type have a drawback because they can cause tissue heating. So from the what we need in our setup, we need a high power with a miniature. So from the single energy source, we need a dual energy or source. We need dual energy source and high power. So now come to Cyberband. Cyberband system is a dual energy system source. It uses ultrasounds and pneumatic both. Olympus shockwave pulse, it is a dual energy with a single probe. Because of the single probe, it is easy to use. Now come to EMS trilogy. It is also known as Swiss lithoclast. It is power of 3, the power of ultrasound, power of pneumatic, and it has suction capacity. Because of these 3 power, it is very fast, very easy, and it is safe to patient. Take home message, most of the patient with uncomplicated kidney stone can be successfully treated with ESWL. These shock wave break the stone by multiple different mechanisms. ESWL is located on with both anatomical and functional injury of the kidney. We need a ramping up protocol for a safe ESWL procedure. We need to start with slower shock rate and with low power rate, and we need to ramp up the power and rate of the shock. With the high power, and the high shock rate, there is more chance of renal injury. There is minimum uritic injury with pneumatic type of lithotripter, while EMS trilogy use power of 3, ultrasound, pneumatic, and suction. Thank you. So ESWL can be used in all age groups, even in pediatric or in old age groups.
Very specific need to use pediatrics or what the same setting is for them.
Sir, we can start with a lower power and low fragmentation rate. Shock rate.
Then also starting from the low power
Increasing temp of the power.
Naveen? Role of ESWL in ectopic or ectopic. Role of
ESWN in ectopic. So we can use ESWN in ectopic technique, but there is very high rate of retreatment or very and have very poor outcome because of the poor anatomy, because of the if there is obstruction distal to the stone will not pass from the kidney. Stenting will lead to retention of the fragmentations. Yes, sir. Should not be done before ESWLs.
Thank you, Naveen. Thank you, all of you. Good day.